Hello, my name is Steve Wood. Welcome to our podcast, Peers Empower Transforming HIV Prevention and Care, sponsored by the Effie Berry Training Institute. The Effie Berry Training Institute is funded wholly or in part by the government of the District of Columbia, DC Health, HIV/AIDS, Hepatitis, STD, and TB Administration, otherwise known as HOSTA. This podcast is part of the Strengthening the Capacity of the HIV Prevention Workforce Series, which includes a manual entitled Recruiting and Retaining Peers to Support Prevention and Care, as well as a webinar entitled Stability in Uncertain Times, Strengthening HIV Prevention Through Peer Workforce Investment. You can find these resources at healthhiv.org. Today's episode will offer insights into the value peers bring to HIV services, from bridging cultural gaps to increasing engagement and retention in care. We'll also discuss how strong training, guidance, and investment in people with lived experience can build a more inclusive and effective public health workforce.
And my name is Amy Zamad, and I have the honor of introducing our guest today, Ms. Valerie Wojciechowicz. Valerie Wojciechowicz has been in the HIV field for 27 years, and she created and managed medical peer programs, speaking programs, and trainings. Her desire to help improve the lives of people living with HIV is evident. She strives to erase stigma and discrimination and helps others see the value of eliminating stigmatizing language in HIV. Valerie, thank you so much for joining us today.
Hi, Amy. Thanks for having me.
Absolutely. So let's jump right in. Why should someone consider a peer program for their organization at all?
Peers add so much value to the organization in a variety of ways. First of all, meeting with patients. A lot of those folks are living with HIV and have never spoken to anyone else living with HIV. And immediately there's a bond. It transcends everything. And so when we've lived it, I've been living with HIV for 39 years. We've lived it. We've been through it. I remember the first time I had to start taking medicine. And so when somebody has to start taking medicine, I know how they feel, and we can work through things together, like disclosure and things that come up in our everyday life that a lot of folks wouldn't think about. Peers also bring a wealth of knowledge. I often say we are the most knowledgeable people in the building. The doctors can't do what we do. The nurses, what we do is unique because, well, obviously we're living with HIV.
Absolutely. I like that you say that, the word unique. I think that's really important. So, how does someone begin to develop a peer program?
Beginning a peer program requires a lot of thought. First, deciding what do you want it to look like? Do you want your peers to be in patient rooms? Do you want your peers in the EMR system? Do you want your peers to just go with patients to appointments or something like that? It really takes a lot of thought and changes, again, with the implementation typically.
Valerie, what is the benefit of employing peers?
The benefit to the agency is that they've got subject matter experts that most organizations don't have. And not only do we as peers bring a lot to the patients, we also bring knowledge to the organization. Sometimes they might be doing a poster and we'll look at the poster and be like, oh, no. Because this is our life. This is what we do. So our benefit goes far beyond just the patients. Also education. Folks that work in an HIV clinic don't always know a lot about HIV. And here we are, experts that can answer questions, educate, help do everything.
And, a good follow-up is, how does employment benefit the peer?
So for peers, there was a time when a lot of us were too sick to work, and some folks were on disability, some folks still are on disability, and they're afraid to give that up because once you give disability up, it'll be hard to get back on. In the old days, it only took the word AIDS to get on disability, but these days it's a little more difficult. So The benefit to the peer is they can put their toe in the water and work part-time. So a lot of times folks don't know, can they do a 40-hour work week? And it doesn't sound like a lot, but sometimes for us, with the things that we have going on in our bodies and side effects and all of that kind of stuff, it also gives the peers a sense of purpose. Being able to take what we've learned, the good, the bad, and the ugly, and help people with it, I can't describe the feeling. It's just so rewarding. And of course, the peers get paid. They should get paid. And if they're a part of an agency, they'll be part of a team as well, which you don't necessarily have if you're not working in an agency.
That is so important to feel like you're part of, like you said, not just the team, but a part of this movement, right? A part of making that impact. So I thank you for that. I want to close us out with one final question. So we're talking about agencies, hiring peers, being a benefit to the agency, being a benefit to the peer. So from you who have run peer programs, what is necessary to really ensure peer success?
The first thing is to integrate your peers with the team. We show up in a clinic and nobody really knows what we do. And they're afraid, are we going to recommend a medication? Are we going to take the case manager's job? Where exactly do we fit in? And so knowing that up front and making sure that the peers are part of the team, that everything that goes on, just like any other employee, we're not just like that group of folks that hangs out on the side.
That's okay. You're talking about including them. You're talking about ensuring that they fit in the organization and that people kind of know their role. And so just to follow up to that, because I think that's phenomenal. So we're talking peer success in the terms of you want to make them feel comfortable. You want to make sure everybody knows, but to really know that the peer program, the whole program is successful. Give me two things that everybody listening to this podcast needs to know to ensure that once they bring on peers, they're going to want to keep peers for the life of these programs.
So it's important to know the background of the folks that you're bringing on, their personalities, and just like any new hire, it's not just because we're living with HIV would make us good peers. We have to fit into the design of the agency and the group and everything else. And the other thing would be education. Just because somebody's living with HIV doesn't mean they can go out and speak. It doesn't mean that they know exactly what to say to a patient. So very comprehensive education up front, maybe including some of the other staff like case managers. So there is no question about what we're doing. We're not going to recommend a particular medication, the questions that they have, things like that.
Well, thank you for tuning into this podcast. We hope you found this conversation engaging and informative. It's our hope that the tools you receive here and throughout the entire series will enable you to elevate your HIV prevention programs.
Absolutely. And if you enjoyed this podcast, we invite you to check out the many resources we have available for you as part of the Effie Berry Training Institute, which again can be found by visiting healthhiv.org.